Om Shri Dhanvantare Namaha. So let's start the session. Relieving pain, the Ayurveda way. Just I will start with one memorable line from a famous poem written by Percy Shelley. That is, I wish no living thing to suffer pain. That is, aham kamaye etko api jivaha dukkena piditaha na bhavet. That means, in this word, the main mission of the traditional system of medicine, along with Ayurveda, is to promote universal wellness. In achieving this goal, we must not consider pain as an evil all the time. So, because sometimes what happens, it may serve as a red flag to a deeper malaise that needs urgent remedying. So here, no matter however the pain is anywhere in the body, it lands person in a state of discomfort as well as it affects the day-to-day activities. Hence, pain is considered as a major symptom in many of the medical conditions, and that's why it is the most common reason for physician consultation. So with this brief introduction about the pain, I'll start. What is this pain? So here, pain is nothing but it is considered as the highly unpleasant physical sensation. So which is either caused by illness or injury, or it may be because of the mental distress or suffering. As per IASP, that is International Association for the Study of Pain, it is defined as an unpleasant sensory and emotional experience, which is associated with actual or potential tissue damage. So here, pain is usually a subjective experience, and it is also considered as a symptom in most of the medical conditions. Now coming to the approach to a pain, how to approach, even though it looks very simple, the word pain or Vedana, as I have told you, sometimes it may considered as a red flag. That's why proper evaluation of the pain is mandatory before a doctor approaches for its management. So pain, of course, we are having n number of classifications, but basically 4 factors can be considered for approach of a pain. So that is types of pain. So here, based on duration, based on location, based on intensity, and based on etiology. So these are the 4 factors we need to consider when we are approaching the pain. So let's start with the individual one. So based on duration, already everyone know this very well. It may be acute or chronic. Now, whatever the examples I'm going to take here, that is only applicable for Shalakya. I have not compiled other conditions exclusively. Shalakya examples I'll take here. So acute. So like otalgia, toothache. So then trigeminal neuralgia. So these are having acute duration. Whereas headaches, most of the headaches like migraine headache, cluster headache. So these are having the history of chronic duration. Okay. So like that, based on the location, that is the site at which the pain is present. So that has to be considered like headache, toothache, earache, etc. So this is one type of pain. And second type is referred pain. So most of the times, so the pathology lies in some structure, but the pain mimics in the other structure. So for example, otalgia, TMJ, trigeminal neuralgia, etc. That's why the assessment of the location is must before approaching. Now coming to next point. So based on the intensity, we are getting 3 types: mild, moderate, and severe. So in the same way, so again, based on the etiology, so there are 2 types: nociceptive pain and neuropathic pain. Then what is nociceptive pain? So here nociceptive pain is nothing but it's a type of pain which is caused by the damage to the body tissue. So here the presentation of pain is different feelings. So like sharp pain is there, cutting pain is there, aching type of pain is there, throbbing type of pain is there. So in case of nociceptive pain. So based on these typical presentations, so we can come to a proper diagnosis. Then coming to neuropathic pain. Here, this neuropathic pain, usually it arises from the diseases or damage mediated directly to the sensory nerves. So like in case of diabetic neuropathy, shingles, or it's a post-herpetic neuralgia, usually which affects the oral cavity, or it may affect the eyes or ears. So this is based on etiology, the types of the pain. Let's start with the individual part of the Shalakya Tantra. That is, we'll start with the eye pain. Okay. So here, just you go through the picture. So here, we get n number of diseased conditions, like which is maybe related to eye itself or its surrounding structure. So like in the picture, I have given either it's a simple thing, that is glasses, or so refractive errors or inflammatory conditions of the eye, or it may be the surrounding structures like nose related sinusitis or head related cluster headaches, migraine, like this. So all these may result in eye pain. Then how to approach the eye pain? Is it emergency condition, or what is the importance of the eye pain? Otherwise, we call it as ocular pain also. Actually, this is one of the most common complaint what we get in the ophthalmic OPD, as Adur sir as well as madam told during introduction. Not only in ophthalmic OPD, around 2 to 5% of eye pain we get in the general practice also. The patients may approach with a complaint of pain in the eyeball, in and around the eyeball. Then, so that condition is called as eye pain, which are the parts where the pain persists. That can be considered as eye pain, like ocular, periocular, as well as periorbital. The totally all the parts, if presents with a pain, so that togetherly considered as eye pain. Then how to approach? So based on the experience of the discomfort explained by the patient, so we can categorize under two headings. One is ocular pain occurs on the eye surface. So just I want to repeat, if the pain, ocular pain is present on the eye's surface, or second thing is if the pain present within the eyeball, that is orbital pain. So both are different, because this is very important thing when we are like approaching the pain, netra shula or eye pain. So whether we have to differentiate, it's a ocular pain or it's a orbital pain. Okay. So here then what are the points to be remembered? So here, if the eye pain which occurs on the surface, we may get the presentations as scratching type of pain, burning, itching sensation, etc. And here the surface pain, it is usually caused by very simple causes. So like irritation from a foreign object, or it may be infection and inflammatory process of the external structures of the eye, or it may be because of the trauma. Then coming to second one, that is this type of eye pain, that is surface pain. It can be easily treated with some topical treatments. It may be eye drops, which consisting of the antibiotics, anti-inflammatory, and sometimes steroid content drops may be used, or sometimes simple rest in asthenopic conditions, or in eye strain, which also mimics as a eye pain. Simple rest gives best results. That's why approach to pain is very important. Okay. So coming to second category of pain, that is orbital pain. So here it usually affects the deeper structures. Okay. So here it occurs deeper within the eye. Here the pain presentation may be something different compared to surface eye pain. So like aching, gritty sensation, stabbing, throbbing, churning type of pain. So like this. And the approach to such condition is a bit complicated. And even here, this kind of pain has to be evaluated properly. It requires more in-depth examination followed by proper treatment. So this is the difference between these two types of pain and approach. Along with this, whether this eye pain is considered as emergency, of course. So in which condition or which type of eye pain can be considered as emergency? So when it is mainly associated with vision loss. So here, when the eye pain is associated with vision loss, then it has to be considered as emergency medical issue. And second point to be remembered here is compulsorily. So this case should be attended by ophthalmologist immediately. Okay, so this is the thing we need to remember. Okay. So now coming to the common causes, which are the simple causes. Sir, is it okay? Hello.
नहीं है तो रहने दो, अभी दवाई खिलाओ अगले हफ्ते तक.
Then what are the causes for? No, sir. Just I asked. Is it okay?
I have requested all. Madam, am I audible?
Yes, sir.
Madam, I request Santosh, Dr. Santosh Sahu to mute himself. So, I request Dr. Santosh Sahu and others kindly mute yourself.
Okay, then coming to the causes. So causes, as already told, so related to eye structure along with the surrounding parts, so may result in eye pain. So simple, the ophthalmic structures like, so it may be because of the hyphema, scleritis, corneal abrasion, stye, acute angle closure glaucoma, pink eye, which is again having n number of causative factors, dry eye syndrome. So one of the current issue of because of the gadgets. So like this, these are the like some common conditions where the eye pain is the primary symptom. Not only this, the surrounding structure, so like head or nose and paranasal sinuses pathology may result in eye ache. Okay, that's why. So we can categorize under two headings. One is the cause lies in the eye itself, and second one is the surrounding structures. Okay, so here the pain, it is a variable measure. Each person may interpret pain differently. Okay, so if the person complaining of discomfort in the temple area, or sometimes the patient says, I'm having headache over the forehead. So here, this is nothing but it's because of the tension created in the facial muscles. But the presentation is as if the person says, I'm having the pain in the eyeball. So this is maybe because of the some close work done by the patient. And the patient says, I'm having severe pain in the eye, but this is mainly because of the discomfort in the temporal area, or this may be because of the forehead causes. That's why here we need to assess exactly whether it is simple eye strain, and that time it is not associated with the any eye disease. And sometimes some other disease, other symptoms are associated with eye pain. So that has to be evaluated properly. For simple eye strain, so starting from palming of the eyes, many relaxing techniques gives good results. But if the signs and symptoms, what I'm going to tell, if those are associated with eye pain, so need to be take so more precautions. Like if eye pain is associated with partial or complete loss of vision, extremely light sensitivity, tearing, double vision, halos, new floaters, limitation of the normal eye movement, pain with movement of the eye in different directions, sensation of flashes or streaks of light, severe headache associated with pain. That time we need to take special precautions. Okay, so this is about the approach to eye pain in different context. Okay, so then how the pain is treated. So here the treatment may depends on the cause of the pain. A main diagnosis is very important. The most common treatments I'm going to tell here, not each and every cause according to the treatment. So it's a time-taking topic. So just simple methods. We'll start with the home care. Usually just a strain or after close work, eyes close work. So there we need to go with only, so just palming, relaxing, resting, etc. If refractive errors are the causative factors, then we can go with the correction, that is glasses. Then warm compress in inflammatory conditions, initial stages, we can go with a warm compress, flushing, etc. Along with in other inflammatory conditions like conjunctivitis, etc. So we can go with analgesics, antihistamines, antibiotics. Sometimes corticosteroids may be needed. So this is the like common plan of care for eye ache. Okay. So just I want to add one more thing as a preventive aspect. What we are practicing at our OPD, having excellent results. A regular practice of palming. Regular practice keeps the eyes healthy. So the palming technique, this need to be explained to the patient. So you repeat it, if the person repeats this process 3 to 5 times for 5 to 6 times per day is enough. So because here it mainly gives a rest to the eyes. So rest is nothing but a repair of the tissue. That is the concept here. Okay. So then coming to second part, that is pain related to ENT, head and orodentistry. What are the common conditions we are getting in practice? That only I have covered here. So the commonest one is the otalgia. Either it may be referred or non-referred, headache, toothache, and TMJ related condition, as well as nerve related trigeminal neuralgia. So of course, everybody knows the otalgia, so which is of two types, primary otalgia and referred otalgia. So again here, so always approach to the patient counts a lot. Instead of like starting prescription, just go with the clinical diagnosis, go for examination. You get, so here I have given few commonest conditions after ENT examination, what may be the cause. So like starting with simple impacted wax, otomycosis, furunculosis, acute otitis media, then insects, and then next foreign bodies, mastocytitis. So some simple common causes which results in the otalgia. Okay. So then coming to second cause, that is referred otalgia. Already you know very well. Again, because the ear structure as well as the surrounding structures are having same nerve, so innervation. So like it may be from the fifth cranial nerve, 9th, 10th, C2, C3. So like this. So like the oral cavity, parotid glands, tongue, larynx, hypopharynx, cervical spine, as well as the nose and paranasal sinuses. All these structures as well as the ear structures, all are having same innervation. So because of this, if the surrounding structure is having any pathology, the pain may refer to ear. So that is called as referred otalgia. Okay. So here, why this occurs? This may be because of the nerve compression of the nerve irritation. That's why again clinical examination counts a lot in approach to the referred otalgia also. Okay. So coming to treatment. So it initially depends on the underlying cause, and the commonest plan of care is anesthetic drops if the TM is intact, or we can go with the antibiotics, antifungal drugs, anti-inflammatory. Internally, you can go with the NSAIDs, and local, we can go with the hot fomentation as well as nasal spray. So this is the like a common line of treatment, what we can plan in case of otalgia. So coming to next commonest cause in orodontal department, so that is nothing but dental, as the picture shows. So there is a saying, some tortures are physical and some tortures are mental, but the one that both is dental. I think 90% of the, as per the prevalence, 90% of the persons in their lifespan, one or the other time have suffered with the toothache. So now coming to what are the commonest causes, how to approach a dental pain. Again, toothache. So it's again same. One is local causes and second one is the referred causes. So local causes, it may be related to sensitivity of the tooth, gum diseases, impacted tooth, decay, inflammation of the pulp, abscess, cracked tooth. Along with non-dental causes, the commonest one is the sinus infections, especially maxillary sinusitis or congestion of the sinuses. So this is one of the commonest non-dental cause which results in the toothache. Okay. So here the point to be remembered, when so toothache is there, how to approach. Okay. Again, there is a simple technique based on the nature of the pain. So we can do proper diagnosis. For example, so there are two types we can say. One is short, sharp and shooting type of pain is there related to toothache. So then so we may suspect of either if it is triggered by hot, cold, sweet, then so we can suspect the dentine is opened, exposed part of the dentine. It may be because of the gingival recession, it may be because of the fractured tooth, it may be because of the improperly filled RCT, or it may be because of the caries where the dentine is so cracked. Okay. And then if it is triggered by biting, so biting, it may be because of the cracked cusp, or it may be loose filling or fractured tooth. So thus, based on the nature of the pain, so we can like suspect this may be the causative factor. And coming to second type of second type of pain, that is dull, throbbing, and persisting. So here, so again, if it is localized one, the tooth is tender to percussion, then it can be gives idea about the periapical infection, or it may be because of the sinusitis. And coming to local inflammation, then again it may be because of the impacted foot or pericoronitis. If it is generalized inflammation or it is necrosis, then it is indicative of the acute necrotizing ulcerative gingivitis. Like next, one more condition is local or diffused pain. Then it may be because of the TMJ, or it may be because of the dry socket. So like this, based on the nature of the pain, so we can like that helps in the proper diagnosis. Then coming to management. So the commonest word is OTC. So over the counter pain medication. Okay. So n number of medicines we get in the pharmacy, medical shops, like starting from the ibuprofen, PCT, acetaminophen, aspirin, and some local treatments are also explained for this condition. That is some anesthetic gels or paste, which numbs the part, desensitizing to toothpaste or fluoride containing mouth rinses, chlorhexidine mouth washes, otherwise the simple home remedy. So that is hot water with salt gargling, or sometimes if it is bacterial infections, etc., it may be a course of metronidazole tablets. Along with that, one do's and don'ts, that is reduction in the acid in diet. So this is like commonest plan of care in case of dental pain. Okay, coming to the one more part in Shalakya, that is very important part, Uttamanga, that is headache, head. Okay, so headache, again, it is one of the commonest symptom uh, in practice, in ENT as well as in general practice. So it may occur because of n number of causative factors. Either it may be serious or it may not. But so here we need to assess it properly. Thorough evaluation is needed when the headache case comes to your OPD. So basically, there are two types of headaches based on the causes. One is primary headache and second one is the secondary headache. So primary headache, the name itself says the cause may lies in the structures related to head itself, with the structures which are pain sensitive in the head, that is blood vessels, muscles, nerves of the head as well as the neck. So here, so this may also results from some changes in the chemical activity of the brain. Then the commonest primary headaches are migraines, cluster headaches, as well as tension type of headaches, TTH. Okay, coming to secondary headaches. So the name itself says, if the headache which triggers because of the surrounding pathology. Okay, so here the headache triggers or stimulates because of the pain sensitive nerves of the head. The commonest conditions are alcohol induced hangover, brain tumors, blood clots, then carbon monoxide poisoning, concussion, glaucoma, stroke, bleeding in or around the brain. So these are considered as secondary headache. Again, how to approach? In simple manner, based on the site, you can judge. Okay. So TMJ. Okay, TMJ. So when you go through the temporomandibular joint palpation followed by auscultation. So the pain at the temples, preauricular region in front of the ears. That gives you clue. It may be TMJ headache. Sometimes sinus related. Just you go through the sinus examination. Then so that gives you clue. Then cluster headache. Usually the presentation is pain in and around the one eye only. And TTH, tension headache, usually the patient presentation is pain is like a band squeezing the head. And migraine, of course, everybody knows. So here, half-sided headache associated with a classical presentation is there, pain, nausea, visual changes, etc. So like this, so based on clinical examination, we can judge which type of headache it is. Then coming to management. So one is as per the cause, and second one, so plan of care is based on the stages. If acute attack commences, so before the commencement, you can start with the first line of treatment as NSAIDs, mainly contains aspirin or PCM is the commonest medicine what the practitioners are using, or it may be mild sedatives, digipam 10 mg, etc., according to the patient's need. Okay, in moderate attacks, again we can go with the ergotamine, oral ergotamine, like cifagrine, etc., or so sumatriptan, or along with that, some local treatments are explained here, like local fermentation or application of analgesic balms, what we call it as labor, and gels, cold packs over the forehead, etc., along with do's and don'ts, that is avoid the triggering factors. So this is the approach to the headache. So then what are the strategies? So pain management strategies. So one is pain relieving medicines we can plan internally. Second one is the physical therapies are advised, such as heat, cold packs, massage, hydrotherapy, and exercise. And then next comes the psychotherapy. So psychological therapies are cognitive behavioral therapy, relaxing techniques, meditation. And then next comes the mind and body techniques like acupressure, etc. So thus, the medical treatment includes 3 steps. That is, one is non-opioid treatment drugs, opioid drugs, as well as adjuvant drugs generally used for treating the headaches. Okay. So in opioid drugs are tramadol, commonly used one, then codeine, so methadone, pentazocane, etc. Then non-opioid are NSAIDs, acetaminophen, aspirin, etc. Okay. Then coming to adjuvant drugs, which are explained in contemporary science, are nothing but. So these are like, for example, if the adjuvant pain medications, like muscle relaxants, antidepressant medications are explained. Otherwise, sometimes anti-seizure medications like carbamazepine, tegretol, neurotonin, etc. And then sometimes topical anesthetic sprays and pain patches may be used, like lidnoderm, lidnocaine, etc. And last option is nerve blocks along with the anesthetics. So this is about the adjuvant drugs used in case of headaches. Now, let's start with the Ayurvedic aspect. I'll start with the introduction about the pain. In Ayurveda, a variety of terms are used to explain the pain. It's not only one word, Vedana. So here we get many words in relation with the pain. So this shows the peculiarity of the pain in different clinical conditions. Even in Shalakya Tantra, pain is explained as a symptom in many clinical conditions as well as a main disease. So that's why it is better to have a overview of Utpatti, Jnana, and Veda of pain, considering the basic ideas in classics in relation to the Shalakya Tantra. Okay, sorry, it is not. Suggest it's a Sanskrit shloka. The system is not supporting.
Yes, I think
And Yeah,
not
just
shouting. It's okay, madam. Just
okay, just I'll go with anyway.
yeah.
I know the shlokas. Just I'll read. So here the word Vedana.
Yes.
So this is
Yeah, please,
derived
please.
from the dhatu that is vid jnane. That means the knowledge or the perception or the feeling or the sensation or the pain. Like this, we get n number of meanings for one word, that is Vedana. Okay. So here the pain which is experienced by the Chetana Yukta Dhatu. So here see how the Acharyas has explained very nicely. So in Amarakosha we get one quotation that with Chetana Kat Nivaseshu Chushati. That is, in presence of Chetana Dhatu only, the person can perceive the pain or Vedana. So this is the basic word meaning we get in the classics. Okay. So coming to the description, basic description, what we get in classics, especially. So these are the three humors or the basic, the pillars of the body are three doshas. So among these also the vata, so which is the main culprit. So vata drute nasti ruja. So without involvement of the vata dosha, there is no pain, nothing in the body. So that's why Shushruta says, so vata drute nasti ruja. So this is the unique quality attributed by the vata dosha. Okay. So here, because of the yoga vahitva nature of the vata dosha, so not only this, so because of its yoga vahitva nature, it may like combine with the pitta dosha or kapha dosha. When it combines with a pitta, it becomes daha kruta. When it combines with the kapha dosha, it becomes shita kruta. That means the vedana or the pain present in different forms. Along with this, so one more thing I want to highlight here, because the basic concept of lepa is nothing but because of the skin, tvacha. So here sparshanendriya, again this is the seat for vata as well as pitta dosha. That's why basically we need to consider tvacha, vata, pitta. So all these things we have to count when we are planning for any line of treatment. So not only this, so other unique features of the vata, types of vata are, so the indriya pravritti, that is whatever the maintenance of sense organs is there, that is because of the prana vata. And whatever the awakening of mind is there, that is mano bodhana. So because without mana, atma, we are not able to so feel the pain. That's why I told, so without chetana yukta dhatu, pain is insensitive. That's why, so that manobhodhana, awakening of mind, is again one of the karma of udana vata. Okay. So next, whatever the movement is there in the body, that is because of the vana vata. So this explains all the types of vata in one or the other way. So having major role, specific role in Vedana Jnana. So attaining the pain or Vedana. So even as per Acharya Vagbhata also, the Shula is nothing but Viguna Anila. This is the description we get in Ashtanga. Okay. So coming to some Vedana Visheshas, that is some different nature pain are explained in classics according to Vata, due to Vata. So which are the different Vedana Visheshas the person feels? Like Vedana, Swapa, Sada, Ruk, Toda, Beda. So all these are nothing but one or the other forms of pain only, Vedana only. Okay. Angabhanga, Sankocha, Kampa, Vestana, Stamba. Okay. So these are different forms of Vedana or pain produced because of the vitiated Vata dosha. Then in the similar way, so because of vitiated Pitta, again we are getting different types of Vedana Visheshas. I'm not going thoroughly word meaning. Already everybody knows what is this. Daha, Sadana, so sorry, Sadhana, Osha, Chosha, Paridaha, Dhumayana. So because all these words are explained in so Shalakya Tantra, while explaining in the disease context, we get all these different words in one or the other diseases. That's why I have compiled only those words which are explained so in Shalakya Tantra pertaining to disease. Okay. Then coming to Kapha, so Vedana Vishesha due to Kapha includes Suptatva, Alpa Vedanatva and Gurutva. So like this. So these are the Vedana Visheshas because of the, so all the Tridosha related. Then coming to the Vedana. So whether the pain is explained as a symptom or as a disease. Of course, it is considered as in both the senses. In some conditions, it is considered as a associated complaint or main complaint, and in some context, like especially in Nanatmaja Vikharas, our acharyas, while explaining the Nanatmaja Vikharas, some Shalakya related are explained as a disease entity rather than a symptom. So these are Akshibeda, Akshishula, Dantaveda, Dantashula, Karnashula, Lalatabheda, Ostabheda, Shankaveda, Shiroro, like this. So here, so based on these diseases or diagnosis, we can go with exclusively Vata Vyadiva Chikitsa. I'm highlighting here. So Nanatmaja Vyadi Chikitsa we can consider here. Okay. So then coming to Pittaja Nanatmaja Vyadis. So here Dhava Daha. So that is nothing but while explaining the Mukhagata Rogas, we get these words: mouth, palate, lips. Okay. So that time. So Talu Shosha or Talu Daha, etc. Okay. So that's why the plan of care should be as per Pittahara Chikitsa. Pittagna Chikitsa has to be planned. In the same way, Bhavatu. In the context of Chakshu. So burning sensation over the Chakshuradi Indriyas, we get this word. And then Dhumaka, especially while explaining the Nasa. Okay, Dipti Vyadi, we are getting this one. Shiro, Griva, Kanta, Talu, as well as Nasa, Dhuma. That is, in case of Dipti, we are getting such feeling. That is one of the disease. So as per the Nanatmaja Vikara, we can plan exclusively Pittahara Chikitsa. Similarly, so in Kapha, we are getting two symptoms. One is Staimitya, especially in case of Kaphaja Shiro Roga. We get this Lakshana, Staimitya and Gauravata. Okay, according to that, we can plan the Chikitsa. Okay, so here, so thus, so even though all the doshas are involved here, but the basic culprit in Vedana is Vata dosha. So because whatever the body functions are there, all are initiated by Vata itself. That's why as the shloka says. So Pittam Panguhu, Kapha Panguhu. So that shloka says without Vata, there is no movement in the body. When the Vata dosha is in Prakrita Avastha, so all the functions are going on properly. But when it becomes Vikruta or Prakopa, so that results in the Vedana. Okay. So then coming to Nirukti of Shula, we get one more word in the context of pain, that is Shula. Shula is nothing but, so the word meaning is Tivra Vedana. So then coming to Shula definition, so here actually this word Shula, mainly it is explained in the context of Parinama Shula. So not only Parinama Shula, so even in Shushruta Samhita Uttara Tantra, again we get a description. So Shula is nothing but it's a special type of pain. So that's why whatever the person feels as if it is the head is breaking, that's why it is called as Shula. So generally the Shula, it may occur in any part of the body depending upon the site of the body. So the disease is named as like Shira Shula, Akshi Shula, Karana Shula, Basti Shula. So like that. And what are the causes of Shula? Here again, if we know the causes, so as per Kaviraja Gananatha Sena, we get one quotation that Saudnyavahana Nadinam, that is because of the Saudnyavaha Nadis, when they get irritated, this is nothing but nerve irritation only, when they get irritated, so that it results in that is a localized Kshobha in the Saudnyavaha Nadi, so that results in the expression that leads to the Shula, the same expression, the same explanation what the contemporary modern science explains. So now coming to, so what are the causes of Shula and what is the plan of care for Vedana or Shula? So here, so as you know already we have told, so there is no pain without vitiated Vata dosha. Hence, whatever the line of treatment we are planning, so that should be, so like Vatahara Chikitsa. Okay. So the Acharya, we get one more quotation, that is Samprapti Vigatameva Chikitsa. That is, we have to go with some combinations explained in the Charaka Samhita. So as well as in Shushruta, that is Shula Prashamana Dravyas, Vedana Stapaka Dravyas. So here, these types of dravyas are mainly Vata Shamaka Gunatmaka Dravyas. Okay. So let's start with the Netra Shula. So previously I covered with the eye pain, pain in the eyeball. The same thing, we'll start with the Netra Shula. So Netra Shula, so previously as I have told, it is considered as one of the Nanatmaja Vyadhi. So like Akshi Beda, that is nothing but pain only, Akshi Shula, Dhavatu. And these are, even though it is explained as Nanatmaja Vyadhi, and even these are Lakshanas in some Netragata Rogas. So like Puyalasa, Savrana Shukla, Anjana Namika, Parvani, Kupunaka, etc. Okay. So then coming to the Shula or Vedana, so explained in the context of head, ENT as well as orodentistry are toothache. That is Danta Veda, Danta Shula, Karna Shula, Lalata Veda, Osta Veda, Shiroruk, Shanka Veda, Dhumaka, Dava, Dhava. So then coming to the strategies of pain management in Ayurveda. So what are the strategies so we can plan? So here, basically, so this can be divided under two headings. One is pharmacological and second one is non-pharmacological approach. So coming to pharmacological approach, so we'll start with the single drug therapy. So that is internal medicines in terms of Shamanaushadis. Various single medicines are explained for this, along with some formulations can be used as a drug therapy. Along with that, so one more unique contribution from Ayurveda for pain management is external therapies. So these are having excellent results without side effects if we do the therapies properly. So like simple starts with a Abhanga, Svedana, Lepa, Karana Dhupana, Pichus, etc. And then parasurgical approach like Agni Karma, Kshara Karma, Jalokavacharana, and other forms of Rakta Mokshana. So these are very simple techniques, but having excellent results without any side effects if practiced properly. Okay. So then coming to non-pharmacological approach. So this is nothing but, so here Marma therapy. So the pressure points has to be triggering of the pressure points, or various yogas are explained, lifestyle modifications along with the do's and don'ts, otherwise patya. So this can be considered as non-pharmacological. So approach nowadays having much more scope for this field. Okay. So just we'll start with which are the therapies we can implement in pain management in Shalakya Tantra. Different modalities. We'll start with some external therapies. So along with Panchakarma, the commonly used therapies at our OPD. So like simple Snehana, Svedana, Nasya, Basti, and Sthanika Chikitsas, all types of Kriya Kalpas. In eye, Kriya Kalpas, and in ENT, as well as orodentistry, all types of Sthanika Chikitsa. So like Kavala, Gandusha, and then Dhumapana, Pichu, Varti, etc. And one more heading is Lepa, having excellent results in pain management. And then Shastra Chikitsa, Anushastra Chikitsa. In Shastra Chikitsa, especially in ENT, having good results, that is Vedana Karma. Anushastra, already have told. So Shastra, Kshara, etc. And internal Shamanaushadis. So coming to Snehana. So here Snehana, again you can go with the two options. One is Bahya. So that is nothing but Abhyanga you can plan. Otherwise internal Snehapana. So like in chronic headaches. So if you go with simple Gritapana, that to be Go-Gruta along with milk daily. So without like meals, dinner, just you practice this one, having excellent results in Vata-vitiated aches, especially headache, Kshayajanya, or in Vata vitiation. So this is having very good results. Just I am giving one example. Okay. So here, what is the possible mode of action or the possible responsibility mechanisms are? So because it's a very lengthy topic, time taking, in brief, one word I have mentioned here. So one, it may be neurological action, that is gate control theory. Second one, it may be act as a physiological one, that is when taken internally, there may be a release of some biochemical substances, or it may be so mechanical. Okay, like Agni Karma, etc. There is realignment of the muscle fibers. So these are the like probable mechanisms takes place after administering so such type of therapies. Okay, so just I'll give some examples here, like Karna Shula. So multi therapies can be done with these simple available drugs. Asana Bilvadi Taila, Bilva Taila, Nirgundi Taila. Either you can go with a Purana, you can go with a Abhanga, you can go with a Pichu. Okay, so based on the condition. For example, earache referred hai, तो आप कर्ण पूरण कर सकते हो. So otherwise, simple furunculosis, you can go with the Nirgundi Taila. So mixed with the Gairika Churna or Shatadota Grata mixed with the Gairika Churna, go with Karna Pichu. So within 24 hours, it is going to subside. Having excellent results without analgesic drugs, you can manage the condition. So like this, headache, again simple drugs, Balataila. So either Panartha, Nasyartha, Abhyangartha, Basti, Murdni, etc. Multipurpose, this can be applied. Then Himasagara Taila, Himanshu Taila. So here, that's why. So the nature of the pain, basically we need to assess the nature of the pain, do proper diagnosis. That is, which dosha is dominant. According to that, you select the drug of choice. That counts. Okay. So then simple talu shosha, dryness, one of the like complication in diabetic, etc. So we are using simple ghee that is processed with pippali estima. Otherwise, you can take simple gogruta, add trikatu churna and give it internally along with milk or simple grutapana. So this is having excellent results where the person feels dryness, etc. And then Vata, Osta Prakopa, local application, Raladi Gruta. Actually, you are doing one dissertation work, research work on this Vataja Osta Prakopa, especially with reference to cracked lips. So just a simple Abhayadi Taila we are doing, having excellent results. Okay, Pittaja Osta Prakopa, again Estima Dugruta, etc. Okay. Then coming to second local therapy, that is nothing but Svedana. So it is considered as one of the prime treatment in treating the Vata diseases based on its properties, because of its properties. So which helps to subside the vitiated Vata dosha. So here it is nothing but mainly in terms of scientific base, if we tell, so it mainly induces the vasodilatation. So in turn increases the blood circulation. So reaches the target organs, thus helps to remove the metabolic waste and brings the normalcy of the structure. So along with that, if muscle spasm is there, it relaxes the tensed muscles, relieves the pain. Okay. So then one more concept we can say here, that is transient receptor potential channels in terms of like contemporary, if you want to tell. So this is nothing but, so it makes the transient receptor potential channels stimulate. So here the receptors mainly found in the nociceptive neurons of the peripheral nervous system. So here, so these channels are mainly responsible for perception of the heat and pain both. So thus, it facilitating the role of Svedana in the management of pain. So again, in case of headaches, sinusitis, etc. So one of the basic therapy, what we are doing is Svedana. Either it may be Bashpa Sveda or it may be Nadi Sveda, or sometimes it may be simple Upanaha Sveda, or it may be simple, one more drug is Lepa, again Ushna Lepa. So thus this acts as a Svedana karma. So coming to, so these Snehana Svedana therapies can be applied in many conditions, but here I have mentioned a few diseases where the pain is one of the commonest complaint, like Pratishaya. So starting stage of Pratishaya, the person feels osha chosha, burning sensation in the nose, etc. Karna Shula, Manya Shula, Kafaja Pinasa, Shira Shula, and then Osta Prakopa, Utsangini, Kumbhika Pidika. So like this. So few conditions I have compiled here. Of course, we get many diseases. So then coming to next mode of treatment. So applicable in pain management is Nasya. So of course, madam also told. Again, we can consider it as a Shalaki. I consider it as not only half, full treatment, full chikitsa in case of Urdha Jatragata Vikaras. Okay. So the probable mode of action. So mainly, again, it's a lengthy topic. Just in brief, so the olfactory nerves are connected to the higher centers of the brain, such as amygdala, limbic system, as well as hypothalamus. So here one part, that is limbic system. It controls the behavioral pattern, emotions. Along with that, it mainly controls the pain. Okay. So thus in turn helps in controlling the hypothalamus, the ANS, as well as coordinating between the endocrine and the nervous system. That's why it is considered as one of the best treatment for pain management. Okay. So here commonly used drugs are oil based because the pain is mainly because of the vata dosha, and the opposite property drugs has to be used. As per the availability, you can use many oils, but the easily available simple medicine is Anutaila. Otherwise, you can go with the Kshiravala Taila, Nirgundi Taila. So it depends on the pathology, how it is like, whether it is an anatmaja, single dosha, or it is associated. If it is associated with kapha dosha, we can go with the avapidana nasya also. That also helps to relieve the pain. Then coming to indications, of course, a number of conditions are there. What we are practicing at our OPD, I have taken only those examples. So Kapha again simple, commonest disease what we get in the clinics, that is Kapha. So the simple medicine is Gudardraka. Gudanagara Nasya, Avapida Nasya. So having excellent results without a single analgesic antibiotic, we are managing the Kapha frontal sinusitis with only 3 to 7 days of Nasya, along with one Deepana Pachana Dravya. And then Dipti, again, furunculosis can be considered, Nasa Paka. Many conditions can be considered under the context of Dipti. So here Navnanasya with Grita. Simple Go Grita we are like telling in terms of either Pratimarshanasya or Marshanasya, or one more therapy is here, Shatadauta Grita with Gairika. Local Pichu can be done, or we can merely application. That works very well. And Suryavarta, again, one of the easily available drug at our garden, Brungarajaswarasa with Ajakshira. Ardhavavedaka, simple medicine, Dugda and Sharkara. Anantavata, Kshira Sarpi. And again in Anantavata, one more medicine I want to add, that is Kavala and Gandusha with the plain oil, what we are using at home. Either it may be sunflower oil, usually medicated you can go with Kshiravala Taila, or other medicines like Vatahara Tailas. Otherwise, simple sunflower oil, whatever it is available at home. So that also works very well in case of Anantavata. And Savrana Shukla, again, Kshirasarpi is having excellent results. Okay. So then coming to next, one more therapy, what we are practicing is Basti. So in case of chronic pain, so in case of repeated attacks of pain, so again, one of the best therapies, Basti Karma, again, Ardhameva Chikitsa. So one of the chief therapeutic procedure of Panchakarma. So here it is multi-dimensional treatment procedure. So it is having wide range of clinical benefits. So along with its because of its synergetic effects. But the combination, based on the diagnosis, you need to make the combination. Okay. So here, based on the seat of Vata, Pakrashaya Katisakti Shrotrasti. So because all these are seats of Vata dosha, and for the pain, the main culprit is Vata. Hence, Basti works very well in case of pain. Okay. And probable mode of action, again, the rectum has very rich blood supply as well as lymph supply. And the drugs can cross the rectal mucosa like other lipid membrane. So here, so that drugs absorbs through the rectal mucosa. So here, whatever the drugs we are using, the fatty acids, so that are oil soluble as well as water soluble drugs are there, directly enters into the mucosa through diffusion method. So that's why, so you can plan the Basti Chikitsa in case of pain management, in chronic pain, etc. Okay, so indications, again, where the Basti Chikitsa is explained in Shalakya Tantra pertaining to, related to Vedana or pain. So especially in case of Savrana Shukla, Anuvasana Basti is explained. So with Gritamanda, Shatavari and Eshtimadu. In the same way, in Netra Shula, So, irrespective of the cause, Netra Shula, Shambhuka Mamsanasa Bhakti. It is explained as per Vangasena. So, one more yoga is explained for Dharuna Karna Shula. Okay, that is Pipalyadi Taila Anuvasana Basti. Of course, we are practicing Basti, but not same combinations. Other combinations are also we are practicing. Then Shiro Roga, of course, everybody is practicing this one. So, different combinations, especially Anuvasana Basti with any Vatagna Taila, you can practice. So, here Bala Ashwagandha Taila. So, then Ashwagandha Gruta, Bala Guduchadi Taila, simple Dhanvantaram Taila. Otherwise, what the classic says, Gruta, Kshira, Ikshvaku, and then Niru Basti with the Utpalyadi Dravya. So here not only this, so based on our yukti, so we can use different combinations. Okay, these are the references. Then coming to the Sthanika Chikitsa. Actually, this is the unique or speciality of the Shalakya Tantra. So having excellent research. So starts with the Tarpana. Simple will start with the Seka, Ashchotana, Anjana, Tarpana, Putapaka, Pindi, Vidalaka. So here, where to apply or when to apply. So this we need to take care. Okay. In which condition we have to go with the Seka, Aschotana, Bidalaka, Pindi, and which are the conditions where we can apply Tarpana, Putapaka, and Anjana. These need to be so assessed properly. Okay. So these are nothing but simple topical ocular therapeutic procedures considered under the heading of Bahir Parimarjana Chikitsa. So which are boon for treating the netra vikharas. Okay. So here, as these directly crossing the certain barriers, and because of the more time for bioavailability, the contact of the drug along with the deformed structure is more, that can be like managed. That's why, so this is having excellent research. Okay. So as per Sharangadara, Acharya Sharangadara, so has given a clinical order of applications of these therapies, where to apply, when to apply, how to apply. Initially, he explains that Netra Parisheka, that is Seka, Aschotana, Pindi, and Bidalaka. So these are the four therapies, topical treatments has to be applied in case of Amavastha, inflammatory process. Because as already Madam told, there are 5 Lakshanas of inflammatory process. So amongst that, so one is pain. Okay. So the first one is the pain. So that time you need to go with first 4 therapies. And when, so there is Niramavastha, so you can go with the, other 3 therapies, that is Tarpana, Putapaka, and Anjana. So these 2 points you have to keep in mind when we are applying the Kriyakalpas. Seka, already you know, so mainly indicated for the acute inflammatory conditions. As it is apatarpana in nature, we are using kashayas. So Amavastha of Netra Roga is the main indication, mainly helps to do the pachana of the doshas. Not only this, even as per Charaka, Dravasveda. So that is explained in Pitta Samsushta Vyadi. So where the eyes are having Pitta association, eye diseases are having Pitta association. That is nothing but inflammatory conditions of the eye disease can be considered. Okay. Again, definition of Seka. Already you know very well. So this is the same shloka of this one. Just I'll skip this one. The Sekaha Sechanam, you know the shlokas, the references also. Sekastu Sukshma Darabihi. That explains how the procedure has to be done. Then coming to the combinations, the commonest combinations, what we are practicing, Shveta Lodra Kashaya, or one more is Eranda Patratwak Mula Kashaya, Ajakshira plus Saindava, and then Haridra Devadaru Kshira Kwata, added with Saindava Lavana, or Drakshadi Kwata, Trifla Lodra Eshtadi Kwata, then Lakshadi Kwata, like this. Simple medicines are explained for pain management in case of inflammatory conditions of the eyeball. Okay. So coming to next topical treatment is nothing but Ashchotana. So Ashchotana, again, it is considered as the first step, has to be done in case of pain as well as inflammatory conditions of the eyeball. That is nothing but Sarvesham Akshiroganam Adau Ashchotanam Vidihi. Ado, the first treatment explained for Akshiroga is nothing but Ashchotana. Okay. So the clinical conditions like Ruktoda Kandu, Garshaha, Akshihi, Daha Raga, so Nivarana. Okay. So these are the conditions which are explained in Ashtanga Hridaya. Okay, Sutrasthana. So the commonest drugs, again, Drakshadi Ashtrotana, Saindavadi Ashtrotana, Shigrupatra Swarasa, etc. So this is again used for the pain management. So mode of action. So again, we get the shloka in Ashtanga Sangraha Sutrasthana, how the drug so works here. So in Seka and Ashtrotana, the Kashaya and Sneha Dravyas are used actually. So these cross the corneal epithelium easily, and as both the contents are so lipophilic as well as the hydrophilic properties. Okay. And along with that, the contact time is more. That's why the drug absorption is more. So thus, so these procedures helps or increases, enhances the lubrication and does the nourishment and helps to remove the toxins from the eyes. So not only this, it improves the vascular supply. So mainly warm kashaya is used for the sekartha. So thus it results in the vasodilation, helps for faster and effective absorption. Okay, so this is the probable mode of action of the two therapies. Now coming to next procedure, that is the picture can say, so shloka, because of font, I am not able to this one, show this one. Pindi. So Pindi is nothing but Pindi Kavalika Prokta Badhyate. So Vastra Pattakaihi. This is nothing but a gauze piece. So sterile gauze piece is taken and paste is smeared over the cloth, and that pattaka or that is applied over the so eyeball. Okay, on the closed eyes. That is called as Pindi. Again, in case of pain management, so many combinations were explained, but practically what we are like using. So just I have given here Shunti and Nimba Patra Kalka, Madayantika Patra, Jati Pushpa, then Bringaraja, Lajjalu, Kumari Palpa. So these are the common, easily available at the garden. So those we are using. Coming to next procedure is that is Vidhalaka. So Vidhalaka is nothing but, so it is Vidalako Bahirlepo Netre Pakshma Vivarjite. Except lashes, the remaining eye part, on closed eyes, the lepa has to be applied. So medicine is prepared and that has to be applied over the so eyeball. Thus, it is nothing but again, the probable mode of action is nothing but local vasodilatation, increases blood circulation, thus helps to expel the toxins through the aqueous drainage, helps to relieve the inflammation as well as the pain. Okay, so then coming to the commonest drugs, what we are using for Bidalakar, Shunti Saindava along with the Gritamanda, Lodra fried in Grita, Haritaki fried in Grita, so Chandanadi, Gairikadi, Estadi, Kumaryadi, Mustadi. So like this, many combinations we get for the Bidalaka procedure. Okay, so then coming to some commonest drugs, Ayurvedic drugs, which are explained for pain management and which are easily available. I have made only 5 drugs. So these can be done in multi-combination or single drug can be used. So the Ayurvedic plants useful in painful ophthalmic conditions. The simple drugs. So Bringaraja, Nimba, Manjista, Guduchi, as well as one of the best drug is Dharvi. Okay. So now coming to, so this is about the eye-related pain management. Now coming to ENT, Shiro, Nasa, Karna. So Kanta and Mukhagata Roga, Kriya Kalpas. Actually, the word Kriya Kalpa applies to only eye, but based on the the meaning of Sthanika Chikitsa, just I have written here KK. Okay, so just you go through the picture. So the simple Sthanika Chikitsa explained in classics. Shiro Abhyanga, Seka, Lepa, Nasa Pichu, then Parisheka, Karnapurana, Dupana, Karnapichu, Kavala, Gandusha, Pratisarana, and Lepa. So these are the simple topical treatments explained for pain management in so Anya Urdhvanga Chikitsa. Okay. So here Abhyanga followed by Svedana, one of the commonest procedure. So which can be applicable in pain management. So like Karna Abhyanga, then Shiro Abhyanga, etc. So here How? What is the probable mode of action? So mainly here, this increases the level of dopamine. So it increases availability of serotonin, and thus it uh, elevates the adrenaline, that is epinephrine, and releases the endorphins. So thus it helps, so thus it acts as analgesic effect. So all these neurohormones, so mainly it alters the brain chemistry, which in turn reduces the response to the pain sensation. So as per modern science, as per Ayurveda, so already I have told, vitiated Vata dosha is the main cause for the shula in the Karna, Shira, Danta, etc. And what the drugs we are using, the form of drug is, one is the drugs are Vatagna, and sometimes it is associated with Pittagna. And the form of drug is, so it is usually used in the Ushnavastha, Koshna. Okay. So here the Ushna, Snigdha and Sara properties of these procedures helps to specify the vitiated Vata dosha. Okay. So coming to next, one more simple therapy. So having excellent results, that is labor. This is nothing but topical treatment, merely applying the medicated paste over the affected part. Okay. So here, as already I have told, sparshanendriya, that is the seat for vata as well as pitta. So that's why the main culprit is vata. Sometimes it may be associated with pitta, and the stanika part affected is skin, or it may be mucosal membrane. Okay. Thus, the topical preparation includes many forms of procedures, like it may be lepa, it may be upanaha sweda or malahara, like this. Different forms are explained in the classics. So as per the disease, dosha, dusha, so you can plan one or the other form of therapy. Okay. So here, whatever the drugs we are using for local application are having analgesic, anti-inflammatory, as well as anodine and emollient properties, which helps to relieve the pain. This is nothing but actually here the counter irritant action takes place. Because of the counter irritation, so there is dilatation of the capillaries in the skin. Thus, it increases the amount of blood, so releasing the heat from the body. Thus, expels the toxins, and this helps to reduce the pain. Here, along with that, so it mainly results in stimulation of the large sensory fibers. Okay, so which extends from the tactile receptors in the skin. So thus it suppresses the transmission of pain signals from the thinner nerve fibers. Thus helps to relieve the pain. Okay, and one more concept is the nerve pathways to the brain. So that can be accommodate only one type of signal at a time. And when we apply some counter irritants. This is the mode of action in Agni Karma also. So because we are making some counter irritants. So when two kinds of impulses are simultaneously arrive at the dorsal horns, so the tactile sensation that takes precedence over the sensation of the pain. This is the probable mode of action of the local treatment methodologies. Then coming to simple combinations used in labor. So these are nothing but simple. So severe unbearable headache, Shunti lepa, that is Nagara lepa. In case of Nasa Paka, unbearable Daha Osha is there, so Shatadota Grutha. So in case of Dipti, Gairikadi lepa. So in case of Vataja Shirashula, Sarivadi lepa, Pittaja Shirashula, Chandanadi lepa. So like this, n number of combinations are explained in classics. Either it is single or in combinations. Now coming to, so next pain management therapies, Kavala and Gandusha. Okay, again, two primary and effective oral cleansing techniques and specialized treatments, therapies to treat as well as for prevention of the oral diseases. Again, probable mode of action, so maybe increase in the saliva. So here the saliva contains lysosome, an enzyme, and antibody IgA. So which are having the properties of bacteriostatic as well as antimicrobial in nature. Thus helps to relieve the inflammatory process, in turn helps to relieve the pain. Okay, so this is one thing. Second one, actually, the Kavala Gandosha, these increases the pressure in the mouth. So that stimulates the stretch reflex. That is nothing but the presoreceptors resulting in stimulation of the salivary nuclei in the brain. Thus brings more lysosome, helps to relieve the pain. Okay. So this is the probable mode of action and some common combinations as well as the disease conditions chaladanta. Okay. So previously I have told toothache and how to approach. The commonest medicines what we can use is so the Shamula Kashaya along with some fat. You can add ghee, vasa, etc. But usually we can go with a ghee. Danta Harsha, Danta Veda. So Tiladi Taila or Eshtimadukadi Taila or simple Tila Taila. Krumidanta, so one of the drug of choice is Irimedadi Taila. Otherwise, Kwata we can use. Tiladi Kwata, Erandadi Kwata, Panchavalkala Kwata. So based on availability of drug and properties of drug, you can choose any form of drug. Then coming to next, one more pain management therapy is nothing but Karna Purana. Again, one of the local treatment giving excellent results without any analgesic. Okay, so here Acharya Dallana said oil spreads into the deeper structures, that is rasa and rakta dhatu. And because of the warmth of the oil, it improves the blood circulation and then the drug spread through the ear. Actually, research work is needed in this field. So because exactly it's a hypothetical, the concept we can say, conceptual theory we can explain, but one theory explained what we have read in first year, that is Kriya Kedari Kulya Nyaya. So that can be connected with this theory. So here, which does the microcirculation and helps to specify the vitiated Vata dosha. But here research work is needed for this Karna Purana. At what level the absorption of the oil takes place, because it helps in prevention as well as like arresting the sensorineural hearing loss also. Okay. So the common drugs used for Karna Purana, and then other forms also we can do here, like Pichu also we can do, Dhupan also we can do for pain management in relation with the Karna Shula, Deepika Taila, Ashtamutra Varga, Bilva Taila, Nirgundi Taila, Lashuna Swarasa, etc. Okay. So now coming to second form of Chikitsa, that is Shastra Chikitsa. Okay. So Shastra Chikitsa, so basically in Shalakya, one therapy we get, one Shastra Chikitsa is explained for many conditions related to Shalakya Tantra, that is Vedana Karma. So one of the Ashta Shastra Karma explained in Shushruta Samhita, that is, we call it as Vidya Karma. So mainly special hollow needles are used that results in painful mechanical stimulus, which causes again release of the endorphins, thereby causing immediate pain relief. So especially told in case of Pratishaya. So for the over the tip of the nose, Vidya Karma is explained. In Adimanta, Apanga Sandhi. In Akshipaka, Lalata and Apanga Sandhi. In Shirashula, Apanga Sandhi. So like this. Okay. Agni Karma. So mainly, Vedana Karma. So mainly helps to relieve the pressure and thus helps to pacify the pain. Then coming to Anushastra Chikitsa, so all the karmas are explained. Anushastra karmas are explained. So start with the Agni Karma. So mainly because of its properties, it pacifies the Vata and Kapha dosha, thus helps to reduce the pain. Okay. So here the hypothesis means the release of heat. It could have caused irritation on the superficial sensory nerve endings, so thereby relieving the pain from the concept of counter irritation. How the counter irritants acts already I have told in the previous slides. Okay. So here one more possibility. So that is, it mainly helps for the muscle relaxation. Okay. So that is the mode of action. And as it is Ushna, it the whatever the disease occurs in the body, so because of Amavastha, thus this Agni Karma helps to so release remove the accumulated metabolic waste products in the tissues, so increases the blood flow and thus helps to so relieve the pain. That may be the one of the probable mode of action. And which are the diseases indicated for the Agni Karma? So again, in number of diseases are explained in the context of Agni Karma. Shalakya related Dalana, Krumidanta, Abhishanda, Adimanta, Puyalasa, Pakshma Kopa, Lagana, Vataja Shirashula, and Kafaja Shirashula. Okay, so coming to next therapy. So that is nothing but Rakta Mokshana by Jalokavacharana. So here again, it's mainly bloodletting therapy. Here the sensory stimulus caused by the pain and burning sensation of the leech bite. So that can alleviate the symptoms. Again, the theory is gate theory it is. So this is the main concept. And second one, so whatever the pain is produced, it may be like not only vata, pitta along with rakta associated, thus helps to relieve the vitiated rakta, subsides the pain. Along with all these, so one more thing need to highlight here is the saliva of the leech. So which is hirudin. So mainly it it acts as anti-inflammatory and it inhibits the trypsin or carboxypeptidase. So A inhibitors, which increases the inflow of the blood at the bite site. So here histamine-like substance, acetylcholine, acts as a vasodilator, and anesthetic substance is there in the saliva of the leech, thus helps to relieve the inflammation as well as pain. And the indications for this procedure are Puyalasa, Savarna Shukla, Abhishanda, Arma, Utsangini, Potaki, so Ajaka Jata, Nasa Paka, Pakshmashata. So these are the some topical treatments along with Panchakarma as well as some internal Shamanaushadis explained in the classics for the pain management in Shalakya Tantra. So along with that, so non-pharmacological many procedures were also explained in terms of yoga, pranayama, meditation, along with do's and don'ts. Okay, so thus coming to end of the session by concluding that pain, so it has been given utmost importance in Ayurveda as well as in contemporary science, offering varied treatments to cure the condition. So here in treatment modalities coming to Ayurveda, so such as Agni Karma is explained, surgical is explained, parasurgical is explained, local treatment methodologies are explained to relieve the pain, even acute pain also. There is a misconcept or wrong concept that Ayurveda is not able to cure the acute pain. No, this is not the condition. Okay, Ayurveda can give relief for acute conditions also. Immediate pain relief can be done with Ayurvedic approach, so without untoward effects. But the thing is, re-exploring of the therapeutic pain management strategies needs validation, and it has a wide scope for future research in pain management through Ayurveda. So to conclude, so Ayurveda gives a very clear and specific information about the pain, its types, as well as it also provides the information on various herbo-mineral formulations along with external therapies in terms of surgical, parasurgical, as well as panchakarma. So it may be worthwhile to take up pure studies like single symptom, single medicine like that, where oral as well as external therapies for specific pain types may able to bring new leads for the pain management in the field of Ayurveda. So keeping this view, so last year we have done one research work, so PG work, that is pain management with Hingu Dharana in toothache. Exclusively we have taken only one symptom, single drug therapy, got equal results like that of the paracetamol. So this is the research, just I have shared only two research along with other clinical experience sharing that need a lot of time. So with this brief information about the pain management, so I'll conclude my session. Thank you, everyone.